Hi, my name is Dr. Cary Gans, and in this brief hangout, I wanted to discuss the topic of how to treat TMJ pain. Now, the reason I decided to do this is because I get this question all the time. I am the president of the Long Island Group for Headache Management. A lot of the people that we see have pain in their upper jaw, pain in their head, chronic headaches, neck pain, things of that nature. A lot of it relates to the temporomandibular joint, which is the joint, the hinge of your lower jaw and your upper jaw. This joint is the only joint in the body that works bilaterally, meaning it's joined together with your lower jaw. Your knee joints and your arms and your everything else are unilateral. This is the only joint that really is bilateral, and it has to work symmetrically. So what happens is if everything is out of balance, and I'm not going to go into detail with that. Certainly, if you want to give us a call or come in for consultation, we can talk about it. But everything in your functioning sphere of your mouth and your head has to work in balance. It's very important that the muscles of your face and your head and neck are balanced, meaning that the right and left side work simultaneously. If they don't, one side starts to hurt. No different than if you always ran on your right leg, eventually that right leg would hurt. Well, if you're always working the right side of your mouth more, you can imagine that the right side is going to start to hurt. It's a little more complicated than that, but that's basically what happens. Now, this can be caused by many things. It can be caused by accidents. And the accident doesn't actually have to be something that happened yesterday. It could have happened months ago, even years ago, that throws everything out of kilter. It could just be a small filling you had put in by your dentist. And that filling now changes your bite a little bit. You accommodate to it by shifting your jaw. And when you shift your jaw now, the muscles on one side have to work harder than the other. This throws this whole system out of balance. And once again, it's that imbalance that causes the problem. Now, the pain that you get from the temporomandibular joint doesn't always relate to this area. The pain you get can be felt in your temporalis muscles. It can be felt in the masseter muscles. It can be felt in the muscles of your neck. It can be felt in many places. It's not just this joint, because once again, when you favor your jaw and you alter your bite, you alter these muscles. These muscles don't work the way they're supposed to. Sometimes it relates to how you can open and close your mouth. You may not be able to open your mouth very wide. Biting into a sandwich can be difficult. You may hear crackling noises. You may hear tinnitus, which is ringing in your ear. Some people even experience vertigo or dizziness due to this because it's right near the ear canal. So the temporomandibular joint dysfunction is a broad term that covers a wide range of symptoms and problems. Well, how do you treat it? Well, years ago, we basically treated it with medication, pain medication, muscle relaxants, and or what's known as a dental splint. It was something that you put on your teeth so that when you bit down, it allowed your jaw to move freely side to side. If you're going to grind or clench your teeth together, you did it on plastic rather than your hard tooth structure. Well, those were long-term treatments, meaning you had to wear these splints for years, or you had to take medication for years. A very small percentage of patients required surgery for such things as osteoarthritis of the joint, things of that nature. But that's a very small percentage. Most people basically have a problem relating to a bad bite, muscle dysfunction, habits, bruxing and clenching, things of that nature, where the system, once again, I know this is getting kind of boring, where the system is once again out of balance. Well, that's not the way we treated it then. It's no longer how we treat it today. Because those old-fashioned treatments basically required you to be on medication for years or wear these splints. For the most part, it was something that people just couldn't do, so the pain kept on coming back. Well, now we use the system that utilizes the same tools they use in sports and rehabilitation medicine, such things as ultrasound, cold lasers, microcurrent technology, and some other tools that, one, are more diagnostic, so we have a better idea of really what's causing the problem. And then we have tools that treat you, that you don't have to do this for the rest of your life. Now, it's a maximum of roughly a 12-week period, and 93% of the people that are treated find that their headaches or their pain or their symptoms are far less in frequency, duration, and severity. Do you get total relief? Well, hopefully, yes. But if we could take you from a 10 on a scale from 0 to 10 and get you down to a 2, that would be pretty cool. So that's what our system does. Now, in a hangout, it's difficult to do this. Nobody's getting on here to ask questions. So what we need to do is get you into the office if you live in the Long Island area, and if you're having chronic head, neck, and TMJ pain, or if you just like more information for a family member, give us a call. It's toll-free, 877-626-0969. That's once again, 877-626-0969. I think that's what it is. Yeah, 0969. Give us a call. I never dial the number. Give us a call. If you want, we can set up a brief consultation at no cost just to talk to you a little bit about what's going on and if there's a system that we have that can help you start living your life again pain-free. That's our goal. Once again, my name is Dr. Carrie Gans. We're here at the Long Island Group for Headache Management in Garden City. We're right across from Roosevelt Field. The mall, we're here early and we leave late, and we're available to help you start living your life pain-free. So give us a call. We look forward to hearing from you. Have a great and successful day.